One had to do with a friend of mine who had a breast cancer, had a small breast cancer detected, had her lumpectomy in the town in which I lived. This was when I was in Texas. And she then spent a lot of time researching to find the best cancer center in the world to get her subsequent care. And she found the place and decided to go there, went there, and which is why I was surprised a few months later to see her back in our own town getting her subsequent care with her private oncologist. And I pressed her, I asked her, why did you come back and get your care here? And she was reluctant to tell me. She said, the cancer center was wonderful. It had a, beautiful facility, giant atrium, valet parking, a piano that played itself, a concierge that took you around from here to there. But, she said, they did not touch my breast. Now, you and I could argue that they probably did not need to touch her breast. They had her scanned inside out. They understood her breast cancer at the molecular level. They had no need to touch her breast. But to her, it mattered deeply. It was enough for her to make the decision to get her subsequent care with her private oncologist, who every time she went, examined both breasts, including the axillary tail, examined her axilla carefully, examined her cervical region, her inguinal region, did a thorough exam, and to her that spoke of a kind of attentiveness that she needed. I was very influenced by that anecdote. I was also influenced by another experience that I had. Again, when I was in Texas before I moved to Stanford, I had a reputation as being interested in patients with chronic fatigue. This is not a reputation you would wish on your worst enemy. I say that because these are difficult patients. They have often been rejected by their families, have had bad experiences with medical care, and they come to you fully prepared for you to join the long list of people who's about to disappoint them. And I learned very early on with my first patient that I could not do justice to this very complicated patient with all the records they were bringing in a new patient visit of 45 minutes. There is just no way. And if I tried, I would disappoint them. And so I hit on this method where I invited the patient to tell me the story for their entire first visit, and I tried not to interrupt them. We know that the average American physician interrupts their patient in 14 seconds. And if I ever get to heaven, it will be because I held my peace for 45 minutes and did not interrupt my patient. I then scheduled the physical exam for 2 weeks hence, and when the patient came for the physical, I was able to do a thorough physical because I had nothing else to do. I like to think that I do a thorough physical exam, but because the whole visit was now about the physical, I could do an extraordinarily thorough exam. And I remember my very first patient in that series continued to tell me more history during what was meant to be the physical exam visit. And I began my ritual. I always begin with the pulse, then I examine the hands, then I look at the nail beds, then I slide my finger up to the epitrochlear node, and I was into my ritual. And when my ritual began, this very voluble patient began to quiet down. And I remember having a very eerie sense that the patient and I had slipped back into a primitive ritual in which I had a role and the patient had a role. And when I was done, the patient said to me with some awe, "I have never been examined like this before." Now, if that were true, it's a true condemnation of our healthcare system because they had been seen in other places. I then proceeded to tell the patient, once the patient was dressed, the standard things that the person must have heard in other institutions, which is, this is not in your head, this is real. The good news, it's not cancer, it's not tuberculosis, it's not coccidiomycosis or some obscure fungal infection. The bad news is we don't know exactly what's causing this, but here's what you should do, or here's what we should do. And I would lay out all the standard treatment options that the patient had heard elsewhere. And I always felt that if my patient gave up the quest for the magic doctor, the magic treatment, and began with me on a course towards wellness, it was because I had earned the right to tell them these things by virtue of the examination. Something of importance had transpired in the exchange. I took this to my colleagues at Stanford in anthropology and told them the same story. And they immediately said to me, "Well, you are describing a classic ritual." And they helped me understand that rituals are all about transformation. We marry, for example, with great pomp and ceremony and expense to signal our departure from a life of solitude, misery, loneliness to one of eternal bliss. I'm not sure why you're laughing. That was the original intent, was it not? We signal transitions of power with rituals. We signal the passage of a life with rituals. Rituals are terribly important. They're all about transformation. Well, I would submit to you that the ritual of one individual coming to another and telling them things that they would not tell their preacher or rabbi, and then incredibly on top of that, disrobing and allowing touch, I would submit to you that that is a ritual of exceeding importance. And if you shortchange that ritual by not undressing the patient, by listening with your stethoscope on top of the nightgown, by not doing a complete exam, you have bypassed on the opportunity to seal the patient-physician relationship. I am a writer, and I want to close by reading you a short passage that I wrote that has to do very much with this scene. I'm an infectious disease physician, and in the early days of HIV, before we had our medications, I presided over so many scenes like this. I remember every time I went to a patient's deathbed, whether in the hospital or at home, I remember my sense of failure. The feeling of I don't know what I have to say, I don't know what I can say, I don't know what I'm supposed to do. And out of that sense of failure, I remember I would always examine the patient. I would pull down the eyelid, I would look at the tongue, I would percuss the chest, I would listen to the heart, I would feel the abdomen. I remember so many patients, their names still vivid on my tongue, their faces still so clear. I remember so many huge, hollowed out, haunted eyes staring up at me as I performed this ritual. And then the next day, I would come and I would do it again. And I wanted to read you this one closing passage about one patient. I recall one patient who was at that point no more than a skeleton encased in shrinking skin, unable to speak, his mouth crusted with candida that was resistant to the usual medications. When he saw me on what turned out to be his last hours on this earth, his hands moved as if in slow motion, and as I wondered what he was up to, his stick fingers made their way up to his pajama shirt, fumbling with his buttons. I realized that he was wanting to expose his wicker basket chest to me. It was an offering, an invitation. I did not decline. I percussed, I palpated, I listened to the chest. I think he surely must have known by then that it was vital for me just as it was necessary for him. Neither of us could skip this ritual, which had nothing to do with detecting rales in the lung or finding the gallop rhythm of heart failure. No, this ritual was about the one message that physicians have needed to convey to their patients. Although God knows of late in our hubris, we seem to have drifted away. We seem to have forgotten. As if with the explosion of knowledge, the whole human genome mapped out at our feet, we are lulled into inattention, forgetting that the ritual is cathartic to the physician, necessary for the patient. Forgetting that the ritual has meaning and a singular message to convey to the patient. And the message, which I didn't fully understand then, even as I delivered it, and which I understand better now, is this: I will always, always, always be there. I will see you through this. I will never abandon you. I will be with you through the end. Thank you very much.
Thank you all. Thank you for your patient listening. Before closing the day, I would like to request you all that tomorrow DHS sir is coming. The program will start at 9. So we should all be on time here. And I request all family members and spouses of our delegates to be here tomorrow because there is some program for them kept in our township. And so you bring your better halves and family members also. Dinner will be at Hotel Sarovar. There will be a visit to our temple, Siddheshwar Mandir. I think I have done my duty today. Thank you all. Good night. Shubh Ratri.